Hey everybody, welcome to The Daily Rinse, episode number 11. I am your host, Christopher Barth, and the topic for today is going to be TMJ, also known as temporomandibular joint, often confused with temporomandibular disorder, or TMD. I always hear a lot of people walking around saying they have TMJ. I've got TMJ. The doctor told me I have TMJ. Well, yes, everybody has a TMJ on this side and this side. They're joints. So everybody has them. They're your jaw joint. And they can be very complicated. So I just wanted to give a little bit of awareness out there for anybody who's having some jaw pain or maybe headaches or anything like that. It all starts with the anatomy. So we've got our lower jaw here that is on a hinge and translational, meaning sliding movement with the joints on either side. You've got the joint that sits in this little capsule. There's actually a disc in there on both sides. And when you open your mouth, the first 15 millimeters approximately are actually just a hinging movement. And then as you open your jaw wider, all the way to the maximal opening, that joint actually slides forward. So it hinges first and then slides forward. And that's how we achieve the maximal opening. This is allowable because we have the disc, two different compartments, and a lot of detail in the anatomy. But the lower jaw is not only rotating and moving forward on that disc and that axis, you've also got muscles, a lot of intricate, delicate muscles that you utilize here to open your mouth and close your mouth and chew and move it side to side. And some of the bigger ones actually form a sling towards the back of your lower jaw. And then there's a couple of smaller bellied muscles that run almost horizontally from the jaw back to the to some of the bony anatomy within the maxilla. So a lot of folks can get pain in this area. I would say that aside from the obvious trauma, if somebody gets hit, whether it be with a blunt object or an accident or an automobile accident or something, you can develop pain there for many different reasons. A lot of the pain I see is pain that is due to multifactorial in nature. And folks are stressed, they have anxiety, they might be clenching or grinding their teeth during the day or night. In particular, if they're doing it at night, they may not have a spouse there to tell them that they're doing it, and they might not even know it. So a lot of times that can go undiagnosed, and it can be very painful. It can be localized to the joint. It can radiate down into the muscles on the side of the cheeks towards the back that you use for chewing. It can radiate up into the head and present as a headache or cause headaches. A lot of it is connected. And another thing that I try to point out is people are always in their posture. A lot of us sit down during the day. Maybe you have a computer desk job or something like that. You're hunched over, you're typing, you're moving your mouse, you're staring at a screen all day. You also have forward head posture, which is very common in dentistry when you're trying to look in a patient's mouth. So you're stressing all the musculature in your neck and your shoulders, and that's all connected in a certain sense. And so if one of those becomes fatigued or weak, another tries to make up for it, and you may experience spasms, or it may present as a headache in the back, even some of the musculature, the occipits and things in the back of the skull that can contribute to pain. So if you're waking up with headaches, if you're having some pain localized to the side, go see your dentist and tell them you have this. There's certain things that we can do to diagnose and try and make you feel more comfortable and manage these things. Of course, there's non-surgical approaches and conventional approaches, surgical approaches and things of that nature, but just so you're aware, these are some of the things you might be experiencing. And then a quick tip I have for trying to alleviate some of that pain or get rid of some of those habits that you may have is analyze self-awareness. Become self-aware during the day, during your job, during your sports, whatever you're doing that's involving activity, whether it's after school or work or whatever. Be aware of your posture. You want to keep your back straight if you're sitting and even standing, and you want to have your shoulders back a little bit, bring your chest almost up, your head as if your chin is tucked. It should not be sticking out like this. That can stress your musculature here. And so once you correct those things, some of the other parts of your neck and that may also become corrected as well. But additionally, you can massage. So I often recommend massaging the area here, up here, the temporalis muscle, which sort of actually connects down into your the jaw down here and fans out up across your head. So a lot of the times people that wake up with headaches in the morning, it's from clenching or grinding, and that is attributing some of that pain up into their head for a headache. Also, this muscle, the big SCM, sternocleidomastoid, because it connects from the sternocleidal joint here up to the mastoid process. If you can see it right there, you can actually grab this, release it, hold it for 10 seconds. You can grab it in certain areas, and it really actually helps us. If it's tender, you know you're sticking your head forward and you have a forward posture. So that's one thing you can do. You can apply moist heat actually on 20 minutes, off 20 minutes will work, in addition to medication, which I know a lot of people like to avoid. But again, see your dentist if you think you're clenching or grinding your teeth. There's certain things and appliances that can be made and analyses that can be drawn to help you become more comfortable as a patient and manage that disorder. They call it a disorder, but it's pain, it's discomfort and things of that nature. So I hope you all learned something from that. I know it was quick and brief and I sort of jumped around a little bit, but it was simply to just make you aware of those things and that they're out there. So if you have any questions, drop me a line on the email, thedailyrinteshow@gmail.com. Again, I'm also on Instagram and Twitter pretty frequently at doc_gums. And until the next episode, I hope you guys stay clean. Thanks.